I'm just gonna throw something out there. People with rectums don't have that ability. Hey guys, it's Maggie and I am back today, and for today's video, I thought that we could go over some misconceptions that people have about ostomies. And I'm doing this because I've been getting a number of comments recently about assumptions that people have when it comes to living with a stoma and managing one. Now, I really want to thank some of the new subscribers that I've gotten on this channel. Some of you are patients that either have an ostomy or may be facing one in the future, so hopefully there's something on my channel that will help guide you in your journey, really. And thank you to those that don't live with an ostomy. Maybe you're just curious, maybe you know somebody with an ostomy, and you're just trying to become more familiar of, what it might be like to live with one. I think that is so cool, and I just really appreciate you being here, so thank you so much. But let's get into some of these assumptions and what it's actually like, the real truth of living with an ostomy. Okay, the first comment that I've been getting quite a bit lately is that I look far too young to be living with a stoma. And that is actually a huge misconception when it comes to stomas. Many of you know that I worked as a pediatric GI nurse, and I also worked as a telehealth ostomy nurse. I'm not a WOCN, I'm not a wound ostomy continence nurse, but I worked alongside them and I helped with specifically ostomy patients. And there are such a variety of reasons that people get stomas. I took care of little newborn babies that were given stomas for different disorders, different congenital defects, different motility disorders. For myself, I have an ostomy because of inflammatory bowel disease. Some people do get it for colorectal cancer. Some people get it because of radiation side effects. Radiation can cause damage, so sometimes people wind up with ostomy surgery because of it. I'm trying to think of all the other reasons. There are so many different reasons a person can get a stoma, and I think the stigma around it is that only older people get it when they've had colon cancer, and that is not the case. And colon cancer is affecting people younger and younger, it seems like, every day. So just keep that in mind. Make sure you're getting your colonoscopy. That's something I don't have to worry about. Another thing that people assume, particularly about my ostomy, is that I live with a colostomy. Colostomy, I think, is the more well-known term when it comes to stomas. So people often assume that's a colostomy she's dealing with, especially since I use non-drainable bags. Typically, colostomy patients will go for the non-drainable more because they don't have to empty quite as frequently and the output is a bit thicker for them. But in my case, it's actually an ileostomy. There are a number of different types of stomas. I highly recommend you Google it and see all the different ones made, but mine is actually made from my terminal ileum, hence ileostomy. It's the end of my small intestine, so rather than going a bit further to the point where it gets to the colon, and that's what's brought out to become my stoma, it's just a little bit further up. It does mean that my output is more liquidy, which can be a little bit more difficult to manage. But yes, that is what I'm living with, an ileostomy. I also have been getting a ton of these comments of people just saying, I hope that you can heal soon. I hope that you get better soon. And the thing about my ostomy is that it actually gave me my health and allowed me to heal. To give you a little bit of a background, Crohn's disease has been affecting me for, I think, 20 years now. And I was very young when it started. I was tiny as could be. I weighed about 55 to 60 pounds at the age of 16 because Crohn's disease was just really causing a lot of trouble in my small intestine, in my esophagus, in my stomach, in my colon, in my rectum. It was everywhere. But the worst location by far was absolutely my colon and rectum. So when I had this surgery done, it was done as an emergency, but when it was completed, it was basically taking my colon and rectum out of the equation to give it a rest so that way food was no longer going through it. I didn't have to rely on those two for eating and digesting. So that gave me so much relief. That first month after surgery, I gained 30 pounds. I was eating like I hadn't in years. I was no longer having abdominal pain. I was getting my energy back. I wasn't spending hours in the bathroom. It really did improve my quality of life by so much, which meant a lot as a 16-year-old girl who really had other concerns that she wanted to focus on. It gave me my life back. I think that people see videos with my stoma and they see how red it is and they think, ooh, that looks like an open wound. That looks irritated. The thing about it is that every single person's intestines, as long as your intestines are healthy, as long as they are well perfused, just meaning, has good blood flow, that's what everyone's intestines actually look like on the inside. That beefy red color, it does not mean it's infected. It doesn't mean that it's irritated. That's exactly what it's supposed to look like. If it's any other color, if it gets lighter, like a lighter pink, or if it gets darker, that is cause for concern. It means your stoma is not getting a good blood supply, and that needs to be attended to immediately. I also have been getting a lot of comments of, how does that thing just not fall out of your stomach? Stomas are so cool how they are made. I think the surgery itself is so fascinating, especially when you get into other types of stomas. Mine, I feel like, is a very straightforward stoma. It is called an end ileostomy. So it is just the end of my small intestine, but the way that they sew it into place is, imagine this is my intestine being pulled out of my abdominal wall. They actually will fold it back on itself just like that and sew this edge to your skin. So what you are seeing is actually the inside of my intestine. And there is a chance for it to prolapse, so that would be this happening, like your sleeve is getting pulled further and further out, you're tucking it more over. There is a chance for that. There's also a chance for the opposite, for that to go away and your stoma gets flat on your stomach. Knock on some wood for me. I've had this stoma for 14 years, no revisions, no nothing. I am constantly amazed that my surgeon made such a beautiful stoma that has lasted me so long without any issues. And he did this as an emergency procedure where I was knocking at death's door, to be honest with you. And I have never had a prolapse or a retraction. It has moved a little bit, gotten a little longer, gotten a little shorter. That is more related to when I get a blockage or temperature changes, things like that. And when I sneeze, you might notice that I hold my stomach. If I cough, I hold my stomach in because it's just a reflex at this point. Because I always fear am I going to sneeze my stoma out? But no, it's been intact for 14 years. Thankfully, I don't have issues with that. That's not to say that other people don't. Another misconception is that you cannot have children with an ostomy, and that is not the case either. There are so many people that have gone on to have really healthy pregnancies and even deliver vaginally. As some of you know that have been following my channel, that's been a struggle for me, but in many cases, people can have normal pregnancies. I also get questions about whether or not I have a period, and the answer is yes, I get a period just like anybody else would. That was not operated on. It was not affected, I think, in the way that people think. That's not to say that this surgery doesn't impact your pelvic health. It absolutely can. But in terms of having a regular period, it's not affected. I know that when I had severe Crohn's disease really taken over my body, I lost my period for a few months because I was so thin and so frail. And then once I got my ostomy, it came back. I got healthy again and was able to have a regular period. But yeah, that's not really affected. Another huge misconception, and I've seen this a lot from caregivers or family members of people that have stomas, and that is that they have really bad odor. That is not the case. And here's what I'm going to tell you about that, is that if you are noticing odor from your ostomy bag, either it's been on too long and it's time to change, your ostomy bag is failing you and something's wrong with it and you need to change it, or there's a leak. I think that ostomy bags have come quite a long way, and also the patient needs to be caring for that ostomy and keeping it clean. The other thing about ostomy products now, there are so many ostomy accessories available, and one of the best is deodorizing droplets or deodorizing liquid. This is something that I put directly into my ostomy bag, so before my output ever touches the air, ever comes in contact with the air, any odor from my output is neutralized. I'm just gonna throw something out there. People with rectums don't have that ability, and yeah, as somebody who knows people that are set up the old-fashioned way, I like my deodorizer, and I'm glad that I can use it. Another thing that people always question me about, and they assume that I can't do anymore, is swim. And that is not the case. I always get questions of what do I do in order to swim or take a bath or go in a hot tub? And my answer is nothing. I prefer to wear high-waisted bathing suits for the most part because people do tend to look at your belly when you've got something different than what they have going on. So it's sometimes just easier if I just want to have a fun day at the beach or whatever and don't feel like explaining or experiencing looks, I just wear a high-waisted bathing suit. I don't do anything special beyond that because ostomy appliances are designed to withstand water. The actual flange that sits on your skin can be considered wound care, really, because it helps to pull moisture off of the skin. It can help heal irritated skin around the stoma, so it is supposed to last in water. As somebody who has experienced some problems with my ostomy appliances, some allergies, there was a point where one of the ostomy flanges I was using was really irritating my skin, and something that really accelerated that irritation was water. So swimming, anything like that, I stayed away from. Even in the shower, I was putting plastic bags over my belly to try to keep it dry, to keep my skin from getting more irritated. I remember one time we went to a theme park and there was a water ride, and I wound up having to do a full ostomy change in the amusement park's bathroom because I went on the water ride and my ostomy got a little too wet on it. So that was really frustrating, but for the most part, they are designed to withstand water and be totally fine. I jump in the shower, no issue. The one thing though that I will mention about ostomy bags is there are filters on many of them, and they tend not to be as effective once they get wet. That's the only thing I noticed, but I have never noticed filters to be all that effective to start with, so I don't really care about that. Okay, so those are some of the assumptions, misconceptions that people have around stomas. Let me know if you've heard of any other ones or if you have any questions about my ostomy. I'm trying to get to my comments, but I've been getting a couple more because a couple videos went a little crazy, so little overwhelming, but if you have any questions, I will do my best to answer, and I know I have a bunch of wonderful patients on here as well that will probably chime in as well. So thank you so much for watching this, and I'll see you in the next. Bye, guys.